Enna Vera, and I'm a physician assistant student, and I'm going to be seeing you today. Is this okay with you?
Yes.
And first of all, can I have your age?
I'm 60 years old.
Your first and your last name?
Cynthia Garcia.
Cynthia. And Cynthia, can you tell me what how may I address you today?
Cynthia's fine.
Okay. And can you tell me what brings you in today?
I'm here because I've been experiencing really bad pain on my side.
Okay. And can you tell me a little bit about more about this pain that you're feeling? Is it in your abdomen? Is that what I'm understanding?
Yes, it's more towards the left hand side.
Okay, and so can you show me? It's like on this side.
Yeah.
Okay.
On the lower.
Okay. And when did this start?
It started 2 days ago.
2 days ago.
Yeah.
Okay. And is there anything that you've noticed that makes it better or worse? Maybe like eating. Does it make it better or worse?
Eating makes it worse.
Makes it worse.
I haven't been able to eat.
Okay, so 2 days ago, and you haven't been able to eat. I'm sorry to hear. I know that must be uncomfortable for you. So we're gonna try to help you today. And does the pain radiate anywhere?
No, it's just there, but it's very sharp.
So the pain is very sharp, and does it come and it goes? Or has it been constant?
It's been constant.
Constant. Okay. Let me take a note of that. And so does the pain radiate anywhere? Is there anywhere that you feel it other than on the left side here?
No.
No?
No.
Okay. And is there something that on a scale from 1 to 10, 1 being the low and 10 being the highest, what's the pain that you feel?
It's pretty bad. It's at a 9 right now.
It's at a 9?
Yeah.
Okay. And have you taken anything for it?
No.
No? Okay, now I'm going to ask you some questions about your past medical history. Do you have any allergies?
No.
That you know of? Are you taking any medications other than what you're here for today?
No.
Any chronic diseases that you know of that you've had history, like diabetes, high blood pressure, high cholesterol?
No.
Any surgeries, any abdominal surgeries in the past?
No.
How about any travel recently?
No.
No? Can you also, do you smoke?
Yes.
You do smoke?
Yes.
About how many cigarettes a day would you say you smoke?
About 2 packs a day.
2 packs a day? And do you drink?
No.
Or any illicit drug use?
No.
Okay. How about your diet? What is it usually like?
A lot of fast food.
A lot of fast food? Okay. Do you drink water? How many cups of water do you drink?
Probably just an 8 ounce.
An 8 ounce a day?
Cup of water, yeah. So just pretty much 1 glass.
So 1 glass a day? Okay. Any stressors in your life currently, like high stress, like maybe with work or any situation at home?
As I'm getting older and preparing to retire, yes.
Yes, okay.
Yeah.
How about your family? Do they have any history of smoking,
No.
alcohol, or any chronic diseases?
No, I'm
No?
the only smoker because of stress.
And no chronic diseases in the family, like high cholesterol or diabetes?
Not that I'm aware of.
Okay. Now I'm going to ask you a few questions, so make sure I don't miss anything. This is what we call review systems. I'm just going to see, do you have any, are you experiencing any diarrhea, nausea?
Nausea, yes.
Yes. Any vomiting?
Yes.
Vomiting? How much would you say would you vomited? Like, you can show me with your hands, like a little bit, or?
I would say it seems more like just whatever I can put down in my system because I haven't been able to eat at all.
Okay.
Or anything that, like, if I try to eat, so I guess whatever.
So what you're eating is coming out. You're not holding anything in?
No.
And any constipation?
Yeah. Well, previously I've been constipated.
Any bleeding that you've experienced?
That I'm aware of.
Like a rectal bleeding or any vomiting? Like vomiting of blood?
No.
No? Any changes in your urine?
No.
Or any stool changes?
Just the constipation.
Okay. Any weakness that you've experienced?
Weakness from not being able to eat.
Okay. Do you have fever?
I don't know.
Okay.
I think when I came in, they told me I did.
You did?
I was
Okay.
about the 100.4, I believe.
Okay. Yes, that's a little high. So, yes, you do have a little fever going on. Any weight loss?
Weight loss. Since I haven't eaten in 2 days, I would think so.
Okay.
Maybe.
And you said you have your appetite, yet you haven't been able to eat, right? Okay. And so I'm gonna go ahead and summarize what you told me, and let me know if I missed anything. So you said that you have some abdominal pain here in your lower left side of your abdomen, and it's been going on about for 2 days. And I'm sorry, did this happen suddenly, or did it start? Have you had experiences before?
No, it happened suddenly.
Suddenly, so it's sudden. And you said that it's sharp, and that it's been constant ever since it started, correct? And you said that you have some constipation, some vomiting, and some fever. And you have a history of you're a smoker.
Yes.
You smoke, and you have a high fat diet, and you drink 1 glass of water a day. And it seems that you also have not been able to eat in the past few days because of what you're experiencing right now. And you said you haven't traveled, and is there anybody else in your family that's experiencing similar symptoms?
Not that I'm aware of.
No, so just you?
Yeah.
Okay. Is there anything that I missed?
No.
No? Okay. So I'm going to go ahead and start with the physical exam now. Is this okay with you?
Yes.
Okay. Okay, I'm going to start with the physical, and I'm going to go ahead and start by checking your heart and your lungs. So first I'm going to start with your heart. Okay, good. Now can you breathe through your mouth for me? Okay, now I have to ask you to please turn to your side. I'm going to check your lungs in the back, and can you please put your hands forward like this? Okay, can you think it like this? Okay, and can you just breathe through your mouth for me, please? Everything sounds good? Okay, now I'm going to be doing your abdominal exam. So you can please put your legs up for me. And first I'm going to be moving your top up if you don't mind. Just in here. Okay, good. And I'm going to be first auscultating. And I'm first noticing that there's everything symmetrical and no signs of lesions. Checking your aorta and the renal arteries. everything sounds good. Now I'm going to be percussing. Okay, good. And I'm going to do some light palpation. Let me know if there's any pain when I do this. No pain? Now, let me know if there's any pain when I touch or I let go.
Yeah.
So some pain here? Okay, good. Okay. And now I'm going to go ahead and touch here again. Let me know if there's any pain.
Yes, there is a lot.
Okay. But is there any pain on this side when I touch it here?
No.
No pain on this side when I touch it? Let me try that one. And I'm going to go ahead and also, any pain when I touch here? Let go?
No.
No? Okay, good. And here. Can you take a deep breath for me? Any pain there?
No.
Okay, good. And now I'm going to go ahead and ask you to, I'm just going to pull this down. Okay, so I'm going to mark it right here. Okay, so a normal span of the liver. Now, any pain there? Okay, good. Now I'm going to go ahead and ask you to roll over to this side, please. Yeah, just real quick like that. Now, can you take a deep breath for me? Okay, good. So a normal span of the spleen. And you can go ahead and roll back. Okay, now I'm going to be looking for your kidneys, palpating. So if you could please take a deep breath for me. Okay, so I don't feel your kidneys, so that's normal. And I'm going to go ahead and go on the left side. Can you take a deep breath for me? Okay, I don't feel a kidney, so that's normal. Good. And now if you can please, I'll put this down, and you can please get up for me. Any pain here? Here?
No.
Okay, good.
Look at it too.
Okay, Cynthia, so based on what I've seen today from the physical, I think you have diverticulitis. Considering your age and risk factors such as smoking and a diet low in fiber are some of the risk factors that causes diverticulitis. What it is it's an inflammation of your intestine. So there's these little pouches that are formed in there, and maybe something got stuck there, and it caused some kind of inflammation, which is why you're having the fever today. And like I said, some of the it's not well known why, but some of the risk factors that can happen is the diet and the smoking can contribute a little bit to that. And you do have some constipation, and that's also a consequence from the diverticulitis. So that I know that I explained myself correctly, can you repeat to me what I just explained to you?
You said that I might have some inflammation going on, and some of the reasons why I might be experiencing it is because of the smoking and the constipation, my diet.
So the constipation can be a consequence from it. So yes, but it is an inflammation, and there are some things that we can do today. I can give you some antibiotics, but it has to be IV antibiotics, so we're gonna have to do that and send you in for that. I'm also gonna do we're gonna do a CT scan with contrast, just to confirm that it is the diverticulitis. And we're gonna also have to drink a lot of fluids, and maybe a rest from eating a little bit for now, and we're gonna see how that works out after we do it. And if that doesn't help, or we have any recurrent episodes of this, you need to let me know, because then there might be a chance that if it happens a few more times, we might need surgery to fix those little pouches. That stuff can keep getting stuck in there. We're gonna have the same problem over and over again. So that I know how to explain myself, can you repeat to me what I just said?
That I'm gonna have to reach out to you if I keep having these reoccurrences, or if I have any reoccurrences. For now, drink fluids and not eat.
And what we can also do is maybe later, when you get a little bit better, we need to increase your fiber intake, and try to reduce the amount of foods that are high-fat foods also. Like I said, smoking can actually worsen the condition as well. And considering that you said that you smoked 2 packs of cigarettes per day, we can talk about some more education on smoking, and trying to see how we can help you with that. Is that something you'd be interested in?
Yes.
Okay. And so like I said, just make sure that you call me if it keeps happening again. So can you repeat to me what I just said, so that I know that I explained myself good?
That I'm gonna have to increase my high fiber, and there's possible help for that, for the smoking, because it can contribute to what I'm experiencing right now.
Okay. Any other questions that you may have for me today?
No.
Okay. So that concludes our physical and our exam for today. So I hope that you feel better.
Thank you.
Thank you.